Welcome, everybody, to Defined Contribution is Finally Legal. In this course, we're going to talk about qualified small employer health reimbursement arrangements, which, of course, is a new option for your group clients. This is something that brokers have been excited about for years, about the possibility of having an employer either pay for or reimburse employees for the cost of individual health coverage. That now is allowed. The problem is some think that it's too little too late. And so in this course, we're going to talk about, what a qualified small employer health reimbursement arrangement is, what the rules are, and, whether or not it is a good strategy for clients and maybe, what might be to come for these sorts of plans. This course is a little different. Some of you may have actually taken this course before from me. We've had this filed for a while. However, I've added a whole lot of slides to it because what we're going to do, the biggest feedback that I get from people other than, the idea or the thought that this isn't a good strategy right now based on the way the individual market is. On top of that, probably the biggest feedback I get is that people still have questions. They're confused about it, confused about how it works, and they don't want to mess up. And so the IRS actually put out a list of Q&As in IRS Notice 2017-67, and I have pasted all of them into this presentation. There's a lot. We are going to go through as many as we can just to make sure that you've at least seen this once. It's not necessarily going to make you an expert because there's no way that you'll be able to remember all of the answers to all of these questions, but you can easily refer back to them, obviously. But beyond that, the main reason that I kind of want to go through these is so that you can sort of make a decision for yourself about whether this, even if it is a good fit for your clients, is this too complicated or is this something that, would be worth your time and your client's time. So a lot to get through. Let's go ahead and dive in. So in this class, we are not talking about defined contribution in the traditional sense where an employer decides how much they want to contribute toward benefits and through a cafeteria plan makes a defined contribution and then gives the employees a menu of options to choose from. That idea has been around for years and years. Some employers in the small group market take that approach. A lot of employers in the large group market are offering, an annual benefit amount and then giving employees a suite of options to choose from. Great strategy, but that is not what we're talking about here. Here we're talking about defined contribution for individual plans. So, if you've been a broker in the state of Texas for a while, when you hear the term defined contribution, you probably do think of defined contribution for individual plans, although that that idea is somewhat different from the more commonly used defined contribution strategy. So the reason that you probably have heard the term here in Texas is it's been a big source of debate for years. Back in 2006, the Department of Insurance weighed in on this strategy and more or less said you can't do it. They didn't out and out say that you can't do it. They in fact said that it is legal, but when an employer pays for individual plans, it essentially turns those into a group plan and makes them subject to the same rules and regulations applicable to group health plans, including guaranteed issue and all of the mandated benefits. And because back before the Affordable Care Act, those individual plans were not guaranteed issue and did not cover the same benefits that group plans did, essentially it was illegal to do here in Texas. Affordable Care Act came along and, created the guaranteed issue requirement in the individual market, had the essential benefits requirement, so individual plans cover the same benefits as small group plans. And so it looked positive for a while. Federal government then weighed in, said can't do it. And there's been a long back and forth on this. But the strategy basically here is, or the idea behind it, is that a small employer, maybe one that has trouble meeting contribution requirements for a group health plan or the participation requirements on a group health plan, they would prefer to just give the employees a stipend, a monthly amount that the employees can then use to pay for individual health insurance. So kind of an interesting idea for small employers. The idea of offering group health insurance and all of the legalities that go along with it, the fiduciary requirements, the compliance requirements, that seems like a headache for a lot of small employers. And so they kind of wanted to do something nice for their employees, offer some benefits, hopefully on a pre-tax basis, but not have to actually, have the formal structure of a group plan. And so the idea has been around for a long time. The government's kind of gotten involved and said you can't do it. And more recently, though, they've said you can. So there is now a mechanism to do this legally, and it is through what's called a Qualified Small Employer Health Reimbursement Arrangement, or QSEHRA. So this mechanism, this new type of health reimbursement arrangement, was created back at the end of 2016. It was signed into law under President Obama, became effective in January of 2017. And immediately, brokers and employers were interested in the idea because they kind of thought that this might be a way to not only, give the employees, some help purchasing their health insurance. They also thought this would be a way around all of those compliance requirements that we just mentioned. Here's the problem. While it does avoid some of the group health plan compliance requirements, what you're going to see in this class is that there are a lot of rules and regulations relating to QSE HRAs, and that those rules, following those rules, doing this right, may actually be more difficult than the small group compliance requirements. So that's part of the reason we're going to go through all those Q&As toward the end of the class, because I think that will give you a good idea about whether this actually will make sense for your clients, or is it going to be too difficult? I mean, basically, there are some good arguments for QSE HRAs. In my opinion, simpler paperwork is not one of the benefits. There's still a lot of stuff to do, a lot of I's to dot and T's to cross, so to speak. So again, this was included in the 21st Century Cures Act. Back at the end of 2016, President Obama signed some bipartisan legislation that was meant to do all sorts of stuff to fight opioid abuse and reduce prescription prices and improve healthcare, fight cancer. Joe Biden was very involved in this, and one of his goals was to find a cure for cancer in the next few years. So there's a lot of funding for that in the 21st Century Cures Act, and it was something that both Democrats and Republicans were excited about. However, before the law was signed, or before the law was passed, the Republican lawmakers actually stuck in a provision. It was Section 18, and it was called Exception from Group Health Plan Requirements for Qualified Small Employer Health Reimbursement Arrangements. So basically what this did is it modified the Internal Revenue Code to create an exception for these Qualified Small Employer Health Reimbursement Arrangements, or QSE HRAs, that exempts them from the requirements applicable to group health plans. This was a big issue because back starting in about 2013, the IRS and the Department of Labor and HHS, to an extent, they all chimed in saying that really an employer could not reimburse for individual health insurance premiums through an HRA or a 125 plan or an employer payment plan, because that reimbursement itself was considered to be a group health plan, subject to all of the rules and regulations applicable to group health plans, including the preventive services requirement and including the prohibition, the annual prohibition on dollar limits on essential benefits. And so because the arrangement itself did not cover preventive care, because it was capped at whatever the dollar amount of the reimbursement was, basically they said that it's out of compliance and it's subject to a penalty of up to $100 per day per employee, or $36,500 per year per employee. That was enough to scare an awful lot of employers. And so what this legislation here did is it basically exempted that reimbursement arrangement, this qualified small employer health reimbursement arrangement, from those group health plan rules, so they don't have to worry about the $100 per day penalty and being out of compliance with the Affordable Care Act's requirements. So that's again, that was part of that law. It was signed at the end of 2016, went into effect January of 2017. Basically, the way that the law defined a QSE HRA is an arrangement funded solely by an eligible employer. Of course, HRAs, it's only employer money, with no salary reduction contributions permitted. So in other words, the employer pays X amount to reimburse employees for the cost of individual health insurance. If the premium exceeds the amount that the employer is reimbursing, the employees cannot add their own money through a 125 plan on a pre-tax basis. So they would have to pay their share of the premium with after-tax dollars. The reimbursement is only available after an employee provides proof that he or she or a family member incurred an expense for medical care as described in Section 213D of the tax code, including the premium paid for an individual health insurance policy. So under Section 213D of the tax code, there's all sorts of eligible expenses, doctor visits and hospital visits and dental and vision care and things like that. And a QSE HRA can pay for those out-of-pocket expenses. But in addition, insurance premiums are an eligible expense under Section 213D of the tax code. While like a flexible spending account cannot reimburse premiums, an FSA, which is a 125 plan, specifically excludes premiums as an eligible expense. Under an HRA, insurance premiums are an eligible expense, and individual health insurance premiums are eligible under Section 213D of the tax code. So essentially, this, the employer can put aside money and for the employees, and if they have individual health insurance, they can use that money to pay those premiums. If they have out-of-pocket expenses, they can use it for the out-of-pocket expenses. The amount that the employer could contribute starting year one, so starting in 2017, was $4,950 for single coverage and $10,000 for family coverage. That amount is indexed annually for inflation. So you'll see later on what it is for 2018. The employer is allowed to vary their contribution based on variations in premium that are attributable to age or the number of family members covered. So in other words, if older people would pay more, which of course they will in the individual market, the employer can pay more for those older employees. Obviously, somebody that's covering a spouse or children, they're going to pay more as well, and the employer can also pay more for people that are covering dependents. The variation is determined by reference to the same insurance policy with respect to all eligible employees. What that basically means is that the employer picks sort of a reference plan. So second lowest price plan in the silver level of the marketplace, for instance, and they can vary their contribution based on age and family members for the premium for that plan to come up with the contribution that they'll make toward the policies. And then the employees are allowed to go and pick whichever plan they want in any metallic level. So they're not restricted to that reference plan. It's just used to determine the contribution amount. The amount that the employer contributes would be prorated by month. So if somebody, for instance, they start working in May, and if the QSE HRA started in January, then they would only get 8/12 or 2/3 of the annual contribution. Just like with a group health plan, the employer can put up to a 90-day waiting period in place, but no more than that. They can exclude part-timers from eligibility, just like with a group health plan. One important point is a QSE HRA is only for non-applicable large employers. What that means is small employers not subject to the employer mandate. So if a small employer was under common ownership, with another company, and it pushed them over the 50 mark and made them subject to the employer mandate and the employer reporting requirements and all that, they would not be able to set up a QSE HRA. So even though they might have less than 50 employees, if the combined total of all the companies, if the combined number of FTEs exceeds, or well, is 50 or more, then it's an applicable large employer, and they're not going to be able to set up a QSE HRA. Very important, there is a notice requirement that must be provided. The notice must be provided to employees at least 90 days before the beginning of the QSE HRA plan year. Failing to provide that notice can result in a fine of up to $50 per employee, so a maximum of $2,500. So $50 per employee times the 50 employees, or times up to 50 employees. So here are the high points of this. The reimbursements under a QSE HRA are excludable from gross income if the employee has minimum essential coverage. So this is a tax-free gift to the employee. So it's a tax-deductible expense to the employer, a tax-free gift to the employees, just like any other benefit. The family glitch does apply. What that means is that not only the employee, but their family members as well could be ineligible for a premium tax credit if the amount that they would have to pay for single coverage, that the employee would have to pay for single coverage for the second lowest price silver level plan in the marketplace, if it would be less than the indexed amount of 9.5% of their household income. So that's up to whatever it is this year, 9.6 something or other. So essentially, the same sort of thing that would make an employee and their family members ineligible for a premium tax credit if group health coverage was offered. You know how they base it on the household income, but the single premium. What they would do here, or the single premium after the employer contribution, they do the same thing. They base it on the second lowest price silver level plan, and if after applying the QSE HRA, the employee for single coverage would have to pay less than 9.5% of their household income, then the entire family is blocked from getting a tax credit. Somebody was asking, do I not pronounce it QSERA? No, I don't. I've heard people say that, but whatever. I guess that would be easier. Okay, so it is subject to the W-2 reporting requirement. That's really not a big deal because that only applies to companies that issue 250 or more W-2s. So a small employer would have to have a whole lot of turnover to hit the 250 in a year. So most are not going to be subject to that requirement. Most groups that could offer a QSE HRA would not be subject to that requirement. This is not a benefit that is subject to COBRA, so when an employee leaves, they don't get to continue receiving those employer contributions. Okay, so those are the high points of the law, the 21st Century Cures Act that implemented, or that created the QSE HRAs. Okay, so some agents have said, yeah, but what about the TDI Commissioner's Bulletin? Because unless they rewrite that, I'm not comfortable with offering them here in Texas. Well, again, that bulletin was issued back in 2006, and what it said is that it is not illegal to offer reimbursement for individual premiums through an HRA or some other mechanism, but when you do so, it turns it into an employee welfare benefit plan subject to the all products guarantee, and then sort of implies also the mandated benefits. So I don't think TDI would have even needed to weigh in again on this, because under the ACA, as long as the federal government doesn't object to it, the ACA, with the guaranteed issue requirement and with the essential benefits requirement, it addresses the issues that were brought up in that commissioner's bulletin. So they don't need to chime in again. That said, Tahoe actually went to the Attorney General here in Texas and said, can you weigh in on this? What do you think? And there was an Attorney General's opinion, official opinion on this. Now, that doesn't make it law, but it kind of does. The regulators are likely to kind of follow his lead. So basically, what Ken Paxton said is that the court would likely determine that ERISA does preempt Section 1501.003 of the Texas Insurance Code and that bulletin that we referred to from 2006 to the extent that those provisions propose to regulate a self-funded qualified small employer health reimbursement arrangement. Assuming this opinion is correct, the result is that the sale of QSE HRAs in the state of Texas is lawful. So again, it is just an opinion, but he's basically weighing in and saying, what do we think the court would do? And it is his official written interpretation of the state, or it is the official written interpretation of the state's highest ranking attorney. Long story short, yes, you can do QSE HRAs here in Texas. There's really no reason that you wouldn't be able to. The commissioner's bulletin was also an opinion. It was their interpretation of the existing law, and again, the ACA addresses that, and the Attorney General here in Texas has basically given the green light to this. So if that's your concern, I'm not going to offer QSE HRAs because I don't think that we can do it here in Texas legally. You can. The problem is there's a lot of hoops to jump through, which we'll talk about. The bigger question, really, I think, it's not, is it legal? It's, can it be successful? Because right now, the individual market is a huge mess, right? I mean, there are fewer and fewer carriers that are participating in the, in the market. There are high deductibles, high out-of-pocket costs, shrinking provider networks, skyrocketing premiums. So there's a lot of problems with the individual market. I mean, the biggest deal is that the individual market for comparable coverage, if you can find a comparable plan. I mean, the plan design in the individual market for most of the plans that are offered, they look weird. It's hard to find a comparable plan in the small group market, but to the extent you can compare them, the premiums are higher in the individual market. And so you just, for that reason, it makes you ask the question, well, can this even be effective? Would an employer be doing, their employees a favor by getting rid of a group plan, paying for individual premiums, and letting people go out to the individual market to buy that coverage? Or could they even be hurting them? Because, now not only do people not have a group plan available to them, they may not qualify for a premium tax credit because the QSE HRA might actually make them ineligible for it. So, I definitely think that there are some problems that need to be addressed first, right? There was an interesting point in an article that I was reading about these, and what it says is, although QSE HRAs may be useful for some small employers, for others they may not. These plans are likely most beneficial if employees have individual health insurance under a grandfathered plan, I guess because of the lower premiums there. So in other words, a group that didn't offer group insurance that now is just going to start reimbursing for individual plans. Goes on to say, if employees must buy coverage on the marketplace, this arrangement may make them ineligible for a premium tax credit or may reduce the premium tax credit to which they would otherwise be entitled. If an employee has insurance coverage through a spouse or a spouse's employer, then this arrangement can reimburse for those premiums. But if the spouse can pay for those premiums on a tax-free basis, the QSE HRA reimbursement would have to be taxable. So that's an interesting point. If you can't double dip on the pre-tax benefit. So in other words, the employer could provide the same economic benefit to the employees by simply just raising their wages. Here's another possibility. For employers that, small employers that are having trouble meeting the participation and contribution requirements for a group health plan, they can also just buy a group health plan during that November 15th to December 15th timeframe for a January 1st effective date. That's the open enrollment period for small groups where they cannot be turned down based on participation or contribution. So the employer could contribute a smaller amount or no amount at all to the employees' premiums. They can fall below that 75% participation, and they can still get a group plan, get the better benefits at the better rates, and they could then set up a 125 plan and allow the employees to pay on a tax-free basis. So I really think the availability of those small group plans may be a better option for some of these small employers that are that are considering a QSE HRA. One person said, well, how would a grandfathered plan be allowed since it doesn't include all of the essential benefits? It doesn't have to. It has to be minimum essential coverage, and a grandfathered plan is considered to be minimum essential coverage. So if somebody had a grandfathered individual plan, that could be reimbursed out of a qualified small employer health reimbursement arrangement. Okay. There is another possibility, though. So in other words, if you've heard enough at this point, you're like, well, this is ridiculous. I'm not going to offer one of these because it's not going to be a benefit for my clients. Maybe we should just disconnect early from the call. Here's where I think this could be going. And this is why I think this could be a good option. Because what if it's just the starting point? Several of the Republican replacement plans that, ended up falling short, not becoming law, but they were out there last summer. They included defined contribution language in them. Some of the language that ended up, in the 21st Century Cures Act, it was actually part of another bill first. So some of these replacement plans had that idea in them. Maybe we could see an expansion of these QSE HRA rules if the ACA, or even if just the employer mandate, was repealed. So in other words, if the employer mandate was repealed, then it would probably, instead of it being a qualified small employer health reimbursement arrangement, it would be a different name, and large employers might be allowed to do this. That's one way that they could expand QSE HRAs, right? Paul Ryan, whenever he had his Better Way plan, one of his things that he said in it is, our plan encourages the use of direct or defined contribution methods such as health reimbursement arrangements. These employer payment arrangements allow employees to purchase coverage in the individual market. Our plan encourages the expansion of this arrangement. So Paul Ryan had it in mind. Now, I realize he will be leaving Congress soon, won't be the speaker anymore. So, this might be a little bit less relevant statement, but that Better Way white paper or policy paper, it wasn't just his proposal. I mean, it was kind of in conjunction with other Republican lawmakers. So that's another, statement in support of expanding this sort of strategy. But here's the big one. President Trump's executive order that he issued back on October 12th, 2017, it called for three things, right? One of those things was expanding short-term health plans. Well, we've gotten the final rules on that starting October 1st, or October 2nd, I believe it is. Short-term plans will be expanded up to 12 months. They can be renewed a couple of times. So basically they can last up to 36 months. So that's already gone into effect, or is going into effect. We've got the final rules on it. He called for the expansion of association health plans. Well, guess what? The final rules came out on that. It expanded the definition of associations, or the commonality of interest requirement for an association health plan. And so now employers in the same geographic region, same metropolitan area, or the same state could join together and form an association for the purchase of health insurance. It allows for them to be rated under the large group rules if there's more than 50 total employees. And so essentially it's preferential rating rules for carriers. So small groups can play by the large group rules, and if they've got the better demographics, they could end up winning in this situation. United Healthcare just announced that they're teaming up with the Lubbock Chamber of Commerce to offer an association health plan here in Texas. So that has become law, right? Well, the third part of President Trump's executive order, so right now he's 2 for 2, right? The third part of it was the expansion of HRAs, making it easier for employers to offer HRAs. And it didn't really go beyond that. So it didn't say, offer HRAs to employees in conjunction with a group health plan. It didn't, talk about offering a standalone HRA if you don't have a group health plan that can be used, for eligible expenses the way it was in the past. It didn't talk about QSE HRAs. So it didn't really make it clear, but it did call for the expansion. Well, HRAs were already expanded with the 21st Century Cures Act. So what could that mean? Maybe, maybe HRAs could be expanded so that they don't have to just buy ACA qualified individual health plans. Maybe they could be expanded to purchase short-term plans or to purchase association health plans. In other words, I think that this expansion, given that the administration has been, gung-ho about sort of disbanding the ACA, undoing the ACA to the extent that it can, I could easily see them allowing a small employer to reimburse employees not just for qualified plans, but for short-term coverage and other types of coverage. If that happens, well, short-term plans, you can actually get some of those for less than the cost of group health coverage. And so you very well might see some small employers interested in this option. So we'll see where this goes. We don't have final rules on this yet, but I definitely think we could see an expansion under that executive order. So again, in the executive order, it says HRAs are tax-advantaged account-based arrangements that employers can establish for employees to give employees more flexibility and choices regarding their health care. Expanding the flexibility and use of HRAs would provide many Americans, including employees who work at small businesses, with more options for financing their health care. And so what he called for is expanded availability and permitted use of health reimbursement arrangements. Expanded availability could be perhaps HRAs for individual coverage could be offered to large employers. Permitted use, maybe they expand it again to allow for the purchase of short-term coverage or AHPs. So we'll see what ends up happening, but I definitely think this could go somewhere. Okay, so let's do a quick attendance check. And what we'll do, this is probably a predictable one. I want to get your opinion on QSE HRAs. So what do you think about this strategy? Do you like it? Do you not like it? Are you nervous about it? So if everybody could chime in real quick. All right, so just about all of you have voted, and if you can't access the dashboard, you can send me an email, eric@comedece.com, to chime in, but let's go ahead and share the results here. So as you can see, 30% of you love the idea, and there's a bunch of you that are nervous about it, but you don't say that you hate it. Only 5% of you say that you hate the idea. So the vast majority, it looks like, are at least open to it, and a third of you love it. So, I suppose if, the either the individual market improved, or if it was expanded so that you could purchase other types of products with it, then many of you would be on board with this. So in that case, that means that you probably are interested in the rules, right? Well, we had our initial, our initial, glimpse at the rules in when the law was initially passed, right? It had the initial guidelines. Well, there was some additional guidance that came out in 2017. First, in February of 2017, there was IRS Notice 2017-20. which was basically the transition relief for 2017, because obviously an employer that starts offering a QSE HRA right away, they wouldn't have had that, given that 90 days advance notice and so forth. So that's really over and done with, because that was at the beginning of 2017. It was just the transition relief. So after that, in October of 2017, the Treasury Department and IRS issued further guidance in IRS Notice 2017-67. And under this notice, an eligible employer that provides a QSE HRA during 2017 and 2018 must furnish the initial written notice to its employees by the later of February 19th, 2018, or 90 days before the first day of the plan year. So no more transition relief. Basically, if an employer is going to offer a QSE HRA going forward, they need to, they can't do it right away. They have to offer that initial notice 90 days before the start of the plan year. There are penalties for failure to provide that notice, and those are going to apply to any employer that does not furnish it by that date. So an employer that provided a QSE HRA before the release of this notice, they would actually have to, have until February 19th of 2018 to do it. Otherwise, for those of you that are going to start offering QSE HRAs, just make sure that notice has been provided. It's very important. Okay. So we're not, and we won't get through all of this, but again, everybody, has access to the slides. You can read through it yourself. You can certainly just pull up Notice 2017-67 and go through it. It's 59 pages long. What I did is I pasted all of the Q&As into the slides here. There's 79 Q&As that go with 2017-67. So we've got a little less than 20 minutes left. Let's see what we can get through here real quick, because I think that this will help you just kind of understand all the stuff you have to think about. It's divided into about 13 different sections for the Q&As, 13 different categories. So number one, does an employer fail to be an eligible employer if it offers a group health plan to former employees? Because one of the rules under a QSE HRA is you can't have a group health plan in place. But they're saying, well, yeah, but what if we have a retiree group health plan? Is that going to disqualify us? No. You can definitely do that. You can have a group health plan for retirees. You can't have a group health plan for active employees. Does an employer fail to be an eligible employer if it provides current employees with continued access to amounts that were accumulated in an HRA in prior years, or carryover amounts in an FSA? So if an employer had an FSA with that $500 carryover, or an HRA where they rolled over a portion of the amount that was left, can they keep having access to it? They cannot. That would disqualify them. The employer can suspend the amounts that were available in previous years. So I guess, during the time the QSE HRA is offered, they wouldn't have access. Later on, the employees could have access again, is the way I read it. Does an S corporation fail to be an eligible employer if, separate from the QSE HRA, it reimburses the health insurance policy premiums of a 2% shareholder? So basically, a 2% shareholder cannot participate in the QSE HRA. Well, what if the S corp reimburses them separate? Would that disqualify them? No, but there's another Q&A about the status of an owner as an eligible employee. Does an employer fail to be an eligible employer for any month during which it offers a group health plan? Yes, you cannot have a group health plan and a QSE HRA at the same time for active employees. If one employer in a group of employers that are treated as a single employer under the common ownership rules offers a group plan, may any other employer in the group be an eligible employer? No. So basically, and really, so basically what this is saying is two things. One, if groups that are under common ownership, if the combined total is 50 or more full-time equivalent employees, then none of those member companies can offer a QSE HRA, because they're now considered applicable large employer members. But if you've got a common ownership situation and it doesn't push them over the 50 mark, so maybe two 15-person groups under common ownership, if one of those 15-person groups offers a group health plan, the other 15-person group cannot offer a QSE HRA, right? So they would not be eligible to set it up. Does an employer fail to be an eligible employer if it contributes to the employee's health savings account? And maybe allows the employees to put in their own amount by salary reduction through a cafeteria plan. No, that does not disqualify you. That's not considered a group health plan that would disqualify you. When does an employer fail to be an eligible employer? If it provides a non-calendar year QSE HRA and then becomes an applicable large employer. The short answer is that on January 1st, the year after, or basically determination on a year-by-year basis of whether you're an applicable large employer is based on what you averaged the previous year. So if in 2018 a company averages 50 or more full-time equivalent employees, then in 2019 it would be an applicable large employer. So starting January 1st, 2019, you could not have the QSE HRA anymore, although there can be a run-out period for reimbursing claims. Then there's some questions related to eligible employees. What are the definitions of part-time employees and seasonal employees for purposes of determining whether an employee may be excluded from being an eligible employee? Basically, they're going to use the same, well, actually, they don't use exactly the same terms. So same rules as under the applicable large employer definition. So what it says here is, for purposes of determining whether an employee may be excluded from being an eligible employee, part-time and seasonal employees have the meaning set forth in Section 1.105-11 of the tax code. And what it says is part-time employees whose customary weekly employment is less than 35 hours would be excluded. And then it gives a definition of seasonal employees. Customary annual employment is less than 9 months. So basically, then it goes on to say, notwithstanding the preceding sentence, any employee whose customary weekly employment is less than 25 hours, or an employee whose customary annual employment is less than 7 months, may be considered as part-time or seasonal. So it's weird. They say we use the definition in this other section of the tax code, and then they give a sentence that kind of contradicts it. So 25 hours, 7 months or less is kind of the definition they use for part-time and seasonal. This is question 9. That other question referred to it when about the S-Corp owner. May an eligible employer provide a QSE HRA to retirees, other former employees, or non-employee owners? The answer is no. It can only be provided to active employees. A 2% shareholder who is otherwise an employee is not an employee for purposes of a QSE HRA. An arrangement provided to former employees is a group plan within the meaning of another part of the tax code. Okay. Let's see. When must an eligible employer provide a QSE HRA to eligible employees who previously were excluded under one or more of the categories of excludable employees? Basically, it's going to be no later than the day immediately following the date that employee is no longer in the excludable employee class. So as soon as they become eligible, then they would be offer the QSE HRA. May an eligible employee waive participation? Now, this is a really interesting one. May an eligible employee waive participation in the QSE HRA? The answer is no. That the law requires that an eligible employer provide rather than offer a QSE HRA on the same terms to all eligible employees. They don't allow somebody to opt out of it. Why is that important? Because if an employee could just opt out, then they could go and qualify still for a premium tax credit. But basically, it's this, the employer is providing it. So for determining the premium tax credit, you assume that money is available to the employee and their family members. You can't, the employee can't just say, no, I don't want it. There is a section of Q&As on the same terms requirement. So does an arrangement fail to satisfy the same terms requirement if it is not operated on a uniform and consistent basis with respect to all employees? The answer there is yes. To satisfy the same terms requirement, the arrangement must be operated on a uniform and consistent basis with respect to all eligible employees. And then it goes on and gives a couple of examples, so you can read through those on your own. What type of insurance policy in the relevant individual insurance market may be used as the baseline policy for determining permissible variations? Remember, the employer, if they're going to vary the premium based on age or based on family status, then they would do so in reference to a particular plan. Well, what they say here is the baseline policy must be both MEC, minimum essential coverage, and available for purchase by at least one eligible employee. So that reference plan does not have to be the second lowest price silver level plan. It just has to be a minimum essential coverage plan in the individual market available for purchase by at least one employee. One person says, what happens if the employee is under the spouse's plan from another company and the employee would not qualify for the QSE HRA? They actually would still qualify for the QSE HRA, but basically, so they could still get that money, but and use it to pay premiums on an after-tax basis or use it for out-of-pocket expenses. Let's see, let's go on here. Does an arrangement fail to satisfy the same terms of requirement if it provides for reimbursements up to a single dollar amount, regardless of whether an eligible employee has single or family coverage? And the answer is no. So while the employer can vary based on family coverage, they don't have to. Does an arrangement fail to satisfy the same terms of requirement if it provides for reimbursements up to the self-only and family statutory dollar amounts up to an equal percentage of the statutory dollar limits without referring to a baseline policy? And it says no, and it actually gives an example. So an employer could base this on a percentage of premium as opposed to a dollar amount. One person asked here, can an MEC plan be the only plan offered in this arrangement? So basically, the way this works, the employer is not the one offering the plans. So when you say MEC plan, that kind of almost sounds like, MEC plan like on a group basis, what we call minimum essential coverage plans. When it referred to minimum or MEC a while ago, what that meant is minimum essential coverage. So it was it could be a grandfathered individual plan, it could be an ACA compliant metallic individual plan, that pays at least or has an actuarial value of at least 60%. So there's all sorts of definitions of a plan that meets the minimum essential coverage requirement. That's not the same thing as an MEC plan in the group market, what we refer to as an MEC plan, which is really a skinny plan. Because any group plan is considered to be minimum essential coverage. So, but in this situation, the employer offers the reimbursement. The employer does not pick the plans for the employee. So the employer doesn't say, well, we're going to offer these three individual plans, and here's an amount for you. Basically, the employee can go out and buy any individual plan they want. If they have spousal coverage, they can still be eligible for the QSE HRA payment. It's just they would use it then for out-of-pocket expenses. Does an arrangement fail to satisfy the same terms requirement if it provides for reimbursements up to the self-only and family? Oh, we already did that one. Does an arrangement that varies the permitted benefit based on the number of family members fail to satisfy the same term requirement if it provides a self-only permitted benefit to an eligible employee who enrolls in self-only coverage without regard to whether the employee has a family member that has MEC under one or more separate policies? And the answer there is yes, it would disqualify it. And this gets really complicated. This is the point, and I'm not going to go into detail on this one. Basically, what you can see is these start to, it starts to get much more complicated to satisfy all of the requirements to make sure the employer is contributing the right amount to the right people. Does an arrangement fail to satisfy the terms requirement merely because it determines an eligible employee's permitted benefit based on the employee's family size and age on the first day of the plan year? No, that's okay. What rounding rules may an eligible employer use? Basically, they can round amounts in increments of $50 to the nearest whole dollar, blah, blah, blah. Okay, does an arrangement fail to satisfy the same terms requirement if it limits the permitted benefit provided to two or more eligible employees covered under the same family health insurance plan? So if two eligible employees are married to each other, and so it has the answer for that. Yes, to satisfy the same terms requirement, the QSE HRA provided to two or more eligible employees of the same eligible employer must provide separate permitted benefits. So you can't say, well, we'll just give you the family amount rather than twice the single amount. Does an employer or does an arrangement fail to satisfy the requirement if eligible employees are offered a choice between two different permitted benefit options? For example, the QSE-HRA only reimburses employees for premiums, or the QSE-HRA only reimburses employees for non-premium medical expenses. So, where they try to make the employees choose, yes, that would actually fail to satisfy the same terms requirement. So there's a lot of questions. We're not going to go through all of them. Let me just kind of show you how they're set up. The next set of questions has to do with the statutory dollar limits. So it gives the amount for 2018. I did tell you it was indexed for inflation. So it's gone up from $4,950 to $5,050 for 2018. Went up from $10,000 to $10,250 for family coverage. How are the statutory dollar limits for a non-calendar year determined? They're prorated based on the number of months in each portion of the 2 calendar years. So once the new year rolls around, if the amount changes, then the employer could adjust the amount that they're reimbursing. If the QSE-HRA allows for the use of carryover amounts from a prior plan year, may an eligible employee's carryover amount be added to the newly available amount to provide a total permitted benefit that exceeds the applicable statutory dollar limit? No. An eligible employee's total permitted benefit may not exceed the applicable statutory dollar limit. All right, and it gives some examples. And then, again, many more questions about those. The written notice requirement has questions about, how do you satisfy that requirement? Because, again, there's up to a $50 penalty per employee there. And so it goes into detail, several questions about that requirement. The MEC requirement. So there was a question from an attendee on that. What are the tax consequences for an eligible employee who mistakenly received reimbursement from a QSE-HRA with respect to medical care in a year that they did not have minimum essential coverage? So basically, you can use the QSE-HRA money to pay for qualified medical expenses, so out-of-pocket expenses, but you do have to have minimum essential coverage. So you wouldn't have to have an individual plan. You could have coverage through a spouse as long as you meet those MEC requirements. Then you can take the QSE-HRA money and use it for out-of-pocket expenses. But here it talks about, well, what happens if an employee mistakenly used it for out-of-pocket expenses when they didn't have minimum essential coverage? How do you prove that you had minimum essential coverage? So there's some questions related to that. Substantiation. How may an eligible employee substantiate medical expenses to receive a reimbursement? This is something you would do through a third-party administrator. So in the same way that with an HRA, that a regular HRA that reimburses for medical expenses, you're going to run that through a third-party administrator, and the employer probably isn't going to try to do it themselves. Same thing with a QSE HRA. This is not a do-it-yourself type thing. You need to work with a third-party administrator on this. I really doubt for the commission you'll get on those individual policies that you personally want to get all that involved in this. How do you go about reimbursing medical expenses? So there's some questions related to that. Then there's questions related to, since we're down to just a minute left, reporting requirement. So how is an eligible employee's permitted benefit reported on Form W-2? Again, that's not you're not going to apply for most of your clients because most of them are not going to issue 250 or more W-2s. Coordination with the premium tax credit, very important questions because, again, this can disqualify not only the employee but the family members as well from getting a premium tax credit. Failure to satisfy the requirements to be a qualified small employer health reimbursement arrangement. So what would cause this sort of arrangement to fail? And then finally, interaction with HSA requirements. Does an individual fail to be an eligible individual because the individual has provided a QSE-HRA that by its terms may reimburse any medical expense, including cost sharing? Well, isn't that interesting? So basically, if this can be used not only for premiums but for medical expenses prior to a minimum HSA deductible, that would disqualify somebody from an HSA. Does an eligible or an individual fail to be an eligible individual under the HSA rules because the individual has provided a QSE HRA that by its terms may reimburse only premiums? No. So basically, the employer can set it up to reimburse premiums but not out-of-pocket expenses, and that would not disqualify somebody from an HSA. But if they allow for the reimbursement of medical expenses, it would. Do you fail to be an HSA-eligible individual? If the QSE HRA may reimburse expenses that qualify as permitted insurance or disregarded coverage, in addition to reimbursing premiums for health insurance? No, so you could reimburse for other types of coverage. And then effective date, it just talks about when the guidance goes into effect. So that was a awful lot of stuff, and I know that I think there's a good comment here that sums it up. This is a perfect example of how the government can take a good idea and turn it into mush, one of the attendees said, and I completely agree. So hopefully what this does is it gives you an idea of where to find the answers if you do want to offer this. Kind of gives you a basic idea of the rules, but what you can see is there's an awful lot of rules. And so even if the individual market, improves to the point, or HRAs are expanded to the point that we can use it on short-term plans, that a QSE HRA makes sense. Just realize this is not a great way for an employer just to avoid all the compliance requirements, because there's new compliance requirements. Doesn't mean you shouldn't do it. I think there will be, once this is the market is right for it, I think that there will be plenty of TPAs, that make this as easy as possible. But for right now, I think it's almost premature for many of your clients anyway, to dive into this as a real strategy. But don't totally disregard it, because things can always change, and I think this could be a great strategy going forward if they tweak the rules a little bit. So we're at our time limit. If you have any other questions, please send me an email, eric@comedyce.com. Really appreciate it. Hope everybody has a great day. Thanks.